Hey, so have you ever thought to yourself that not having your period was a blessing in disguise? Or been excited that you only get your period every other month and spend little to no money on pads? Or appreciated the sense of relief because you no longer worry about bleeding through your underwear in public? But then now that you're trying to get pregnant, you are infuriated because no one told you that was not normal. No one told you that if you're not getting your periods regularly, you're probably not ovulating. Or maybe no one told you that your missed periods might be due to a very common condition called PCOS until you actually started trying to get pregnant and couldn't. So I hear you and I'm with you. You're not alone. So many women struggle to get answers from their providers and wait years for a diagnosis. For polycystic ovarian syndrome, it takes 9 years to get a diagnosis. And this is a condition that's often shrouded in mystery and frustration for many, many women. So let's shed some light on it, shall we? Imagine for a moment that your body is like a complex ecosystem, and PCOS is an invasive species that disrupts the natural harmony, leading to a range of symptoms from irregular periods to difficulty losing weight. At its core, PCOS is a hormonal imbalance and a metabolic disorder, affecting how your ovaries work and often leading to small cysts forming on them, sometimes preventing ovulation. So this can throw off your whole menstrual cycle, making it harder to conceive. But here's the empowering part. Knowledge and action can transform your health journey. PCOS is totally manageable with lifestyle changes for most women. By first understanding that PCOS is linked to factors like insulin resistance and inflammation, you can start making changes to nurture your body and restore your monthly menstrual cycles and healthy, regular ovulation. And this involves nourishing your body with specific food combinations that stabilize blood sugars and improve the gut health and the microbiome, incorporating joyful movement for healthy blood sugar balance, like walking just 5 to 10 minutes after meals, or trying some relaxing restorative movement like yoga or qigong, or a really fun dance or HIIT workout. Then some people possibly need some medications or supplements under the guidance of a healthcare provider. And if you're like me and prefer not to take pharmaceutical drugs unless you absolutely need to, then I do have some non-pharmaceutical options that will work just as well as the prescription drugs for PCOS management, such as metformin. So these steps can not only help manage PCOS symptoms, but they really make strides in progress to boost your fertility so that you maximize your opportunities of ovulation. This should be your top priority because you only get 12 chances a year to conceive, and that's if you are ovulating regularly. So if you aren't ovulating, you have fewer chances at getting pregnant. So what's the key takeaway here? First and foremost, if you have struggled with trying to get pregnant and have missed any periods or irregular cycles shorter than 23 days or perhaps longer than 35 days, first off, that's not normal, okay? So remember, anything outside of 23 to 35 day cycles needs to get checked out. And also having no period for more than 3 months is a major red flag that puts you at risk for some serious stuff like uterine cancer, okay? So your irregular cycles may be due to PCOS, but we also need to make sure there's no other underlying hormone imbalances. So it is crucial to talk with your healthcare provider and address these issues. And second, PCOS might make the journey to motherhood more challenging, but it's far from impossible. I have seen so many women make transformations and with the right approach go on to have healthy pregnancies and healthy babies. So it's about nurturing your body, reconnecting with your womb health, and understanding its whispers and signs and symptoms, and then making adjustments that promote balance and fertility health. So if you're navigating PCOS, remember you're not alone. And with an individualized plan and support, you can definitely create your own success story.